Good day, everyone. My name is Charles Hamilton. I'm from the Bahamas. I am APSA's co-president. Um, I was a part of the Europub Health cohort of 2017-2019, where I attended Sheffield in my first year and Jagiellonian University in Krakow in my second year. I wanted to be able to ensure that you as self-funded students are able to have some tips and advice from those of us who've walked along this path before to be able to support you in your decision making about joining the EPH program and funding your studies. So I'm going to see if I can delve straight into my main points. So you got your admission into EPH and you're unsure now where to go. At this point, I'm sure that the consortium would have sent you information on where you can look at for funding. But you have to make decisions fast because you're about to embark on a 2-year commitment. I can tell you what I thought about, what are some of the hidden costs that you need to consider, and what did I go about, or how did I go about doing or funding my studies. So what did I do? When I joined the program, I got my acceptance letter. I said, you know what? I'm on this reserve list. I'm likely not going to get off the reserve list. So let me just take the invitation to come in and see how am I gonna fundraise. I immediately delved into doing a GoFundMe campaign. So I'm gonna share with you what I did. So I started a GoFundMe campaign to try and raise money to go to grad school. Um, I raised the equivalent for my tuition on this particular platform. It was hard. I want to let I want to make sure that everybody understands. If you're going to try this GoFundMe route, you have to treat this as a full-time job. I was working at the time, and when I started this GoFundMe, I treated it as a full-time job. So from the crafting of the content to giving updates on what I would need. I tried to get references from people who were reputable. So at the time, I tried to get references from where I would have done my internship and would have also done a consultancy with PAHO and the WHO, from the ambassador of the United States and Mexico for the Bahamas. My current boss at the time, when I was working in the Universal Health Coverage Program, and also from my former professor. Because when you're going about doing a fundraising campaign, you have to tell a story, right? Why am I'm seeing all sorts of GoFundMe stuff on my wall. Why should I donate to you, right? As you can see, this has about 480 shares. Some of this sharing came from me messaging people to say, "Can you please share this to me?" Even if you're not donating, can you please just share this for me? I'm trying to link to this particular article. My advice to you will be: see if you can take a screenshot of your GoFundMe campaign page and then put a link and then post that to Facebook or to LinkedIn or to whatever platform that you're using, especially Facebook in my context. And then put a small caption on what is it that you want people to do / donate, and then perhaps you would like to use a tool like, let's say, Bitly, right? Sorry, it's loading right now. Yeah, perhaps you want to use a tool like bitly.com. You can sign up with that for free with a Gmail account, and you can create a tracking link so that you can see, are people actually clicking onto your GoFundMe link? Where are they clicking from? How are they clicking it? Use WhatsApp. All right. If you are gonna send people your GoFundMe link via WhatsApp, um, again, take a screenshot of your picture, send the picture first, and then the message you want to accompany with it. Because when you create a caption in WhatsApp for your photo, and people might share it in the future, the caption may become lost, and the caption contains what you want people to do. So think of it all the time. When you're doing stuff in Facebook, when you're doing stuff in WhatsApp, and you want to share links for people to donate to you, um, create a Bitly link so that you can see if your sharing and tracking is being effective. Post the picture, a screenshot of the page that you want people to share to, um, and treat it as a full-time job. I would follow up with people. I created a list of all of my Facebook friends and all of my professional colleagues and family members, and I try to go down that list on a daily basis, um, maybe 20 people at a time, to see, okay, hey, can you share this? Hey, have you been able to donate? Don't badger people. Some people aren't going to have it, but some people may be willing to share. So I also started this campaign by, sorry, I might be taking up a lot of time, but I think that this is important. I also try to utilize. Sorry about this, folks. It is a bit late, and I'm trying to record and do this live. When I was sharing my GoFundMe link, I also tried to connect with newspapers. So I actually I connected with the newspaper companies in my city, and I told them, this is what I'm doing. This is what the EPH program is all about. And I feel like I can contribute so much to my city, to my country. And you really try to, play up that particular story, right? And I hope to amplify the story and the message as well, right? I also did that, so that's for newspapers and for television. I try to get an interview, tell people what I'm doing. You can't be afraid to ask. So that's what you need to do. You have to do that. You have to put yourself out there. You have to be vulnerable. People are not going to just donate to you because you're a smart person, and therefore you need to tell a story, give people a reason to. So, and I did GoFundMe 2 years in a row, right? Now, some context for if you're doing a GoFundMe. I know that some of you may be coming from countries in the global north, and some of you from countries in the global south. If you're going to do a GoFundMe, you need to determine whether or not your country is going to allow you to be able to have access to the funds. So, for example, in my first GoFundMe campaign, you'll see that it says Charles Hamilton is organizing this fundraiser on behalf of Canton Mayor Nod. Canton was a friend of mine who was living in the U.S. And he actually, and it was somebody who I trusted. So like, let's just put the context in there. He was someone who I mentored and whom I trusted, who the monies from the GoFundMe was going to. And I had to make that clear in the GoFundMe campaign, because even though I started the campaign myself, I could not access the money because I live in a country where GoFundMe did not. There we go, right here. I made it clear about Canton. I couldn't access the money. So you needed to check, if I'm going to do a GoFundMe campaign, is my country on the list that will allow me to withdraw funds? If not, you may need to consider if there's any platforms, crowdfunding platforms that exist in your country that will allow you to raise funds, but still use the same techniques that I said about having funds, about sharing your campaign. I'm really sorry. I know that that's a lot, and you all may have more that you want to take from this. Other things that I'm going to suggest to you as well, to try and wrap up, because I know that I'm taking up a lot of time, is think about some of the hidden costs that you don't consider. Okay, you know that you have tuition that you have to raise for, which is about 8,000 euros, I think, if I'm not mistaken. But you also need to think about, if you're traveling to the UK and what's the UK visa cost looking like? Do you have NHS insurance that you need to sign up for? How much is your air travel gonna cost? Do you need to pay for extra bags? What is the cost of books gonna look like? When you arrive in the country that you're at, you're likely gonna need to come up with first and last rent and a security deposit. You're gonna have to open up bank accounts. So people might not be able to send you money right away when you get to that particular place. Do you have enough money to just deal with incidentals when you arrive? You hopefully don't want to have to move, but you may need to. How easy or how hard is that going to be? Do you have a buffer room to be able to do that? Buying or getting together new cooking supplies. You're moving to a new place, right? Think about all of these things that you don't think can add up in terms of the cost. My advice would be is, if you can get your bag shipped to the country ahead of you, perhaps that's something to look into. That's going to have a cost. Okay, I am now rambling, but I'll just show two more parts here. Go to this particular website, Opportunity Desk. They have links here for scholarships. So see if a scholarship is available for you based on some of the stuff here. And there's also competitions that they hold as well to be able to get access to funding. utilize the EPH Health Alumni and Friends Network. Just want to give you insight. I know that Mathilde would have sent around a link for you to sign from EPSA that is for a database. We need your permission to have access to your data for if you decide to join the program, and then we can let you into the secret group, which I think some of you have been trying to get into, which is the EPSA group. Until you have accepted admittance into the program, you have to utilize this open group. People monitor this, and there we go. Yes, people post in here. I can possibly help you. See if you can use the search function. Some questions have been asked before, and we'll try our best to answer questions in here. See if you can tag alumni. See if you can ask people questions in here. Once you have accepted, coming into the program, you can then join the EPSA closed group. We don't let people in until they accept. So you need to let us know, have you accepted when you're filling out the link to join. When you're filling out the link sent by Mathilde, we need to know your information on your Facebook username and whatnot, so that we can admit you. But you also need to let us know, have you actually accepted? Otherwise, we can't let you in. That's just how the group is. And then finally, you're gonna have to probably do some work. So most of you are coming in possibly with some public health experience. So perhaps consider looking at this group. It's a closed group, but look for it, jobs in EPH and GH, because you may likely need to, do some work. I had to work a little bit while I was at Sheffield. We know that the times are a bit different right now because of COVID. There's a lot of remote work opportunities, and I don't want you to be overwhelmed by having to work in order to fund your studies. But perhaps there is a side gig that you can take on that can help to supplement and help with some of your ongoing costs. I did work. I had 2 jobs at one point in my first year that helped me to tide me over. And in my second year, I did not work until I did my internship. But I worked between the breaks in order to raise some additional money for school. And I'm taking up a lot of time. So all I would say is, if you have any additional questions, please do not hesitate to the team here in the webinar. Do not hesitate to reach out to, and good luck in funding us. We really hope that you accept the program, and that we'll have you joining our EPH family in the near future. So have an amazing Friday. All right. Bye-bye.